day everyone. Today we are going to talk about tonsillolith or tonsil stones. Tonsillolith or tonsil stones are the small white particles which you see in the folds in the tonsil. You will see it as small in your tonsil tissue. There may be this small dips in that. There may be white particles sticking out. Many people look at it and they get scared that it is an infection and they try to take it out and they try. And if they go to doctors, sometimes they tell it's an infection and they give antibiotic. Usually, it's not an infection if there is no pain or there is no sweating or redness in the tonsil. If the white stone is sitting there without causing any irritation, it is just a tonsillolith or white stone. It is nothing to get scared of. What happens is our tonsil is not like a smooth ball. It has got these clefts or dips inside it where sometimes the food gets collected. Till 5 years of age, we need tonsils and adenoid tissue which is behind the nose and tonsils which are in the throat to fight off infection. So after the around 5 to 6 years of age, the tonsils and adenoids start shrinking and they become vestigial or rudimentary organs which are there in the body but they are not of use anymore. So this tonsillar tissue, which is a remnant of the old tonsillar tissue, remains with a lot of dips inside it. So when you eat sometimes the food gets collected in the clefts inside the tonsil and that gets attacked by the bacteria in the tonsillar and the oral cavity, and the bacteria breaks down the calcium and magnesium and all in the food and forms these crystals. So these crystals get collected in the dipped portions of the tonsil and it will be seen as white spots. And if you actually gargle or sometimes press that area, you will get a more whitish, like crusty particles which may come out of the throat. This is nothing to be scared of and it's not dangerous. It is not an infection most of the time. Infection usually happens when people try to take it out by repeatedly pressing with their fingers and try to manipulate that area. So if it is just sitting there without any problem, without any pain, anything, you can just leave it alone, or you can just gargle it out. And it usually does not cause any problem to you. Only thing it can do is it can sometimes give a bad odor in your breath. If that happens, you need to address it. Most of the time, a good gargling will suffice. But if it is repeatedly forming and tonsilloliths are very big and it is causing obstruction and irritation and pain because of the size, then the only solution is to undergo a tonsillectomy. Because it happens in older people, we generally don't advise tonsillectomy until unless the patient is really affected by it.